Hello, everyone. I don't know if you saw the post that I did on the weekend. A lot of people shared it about this crazy case where someone had a lip treatment at a clinic, and then they'd had a problem a few months later, 6 months later, and they got in contact with that clinic to try and get their lips sorted out, which I think, reading between the lines, have become hard and lumpy. And the clinic had basically been incredibly rude to them. The person who was on this message had basically accused the person with a lip problem of it being a sexually transmitted disease, which is total nonsense, and basically just trying to insult her in the process of refusing to help her. So, I mean, this kind of thing gets good practitioners rightfully really angry, because we all know how we respond in those situations, which is most medical professionals will go overboard to make sure that that person's helped. And in fact, we also have we have a tendency to blame ourselves long before we start to blame the patient. So there's this sense of like, what if it's me? What if I've missed something? I must make sure that I sort this patient out. And the last thing you're allowed to come into your head normally is, oh, it's just the patient being weird, or, they're tricky people. We tend to take all the responsibility, which is exactly what a healthcare professional should do. But in this particular case, a lot of us often feel, well, what can I do to stop this? Because it's so unfair that these bad practitioners are going around harming people and getting away with it, and they obviously have thriving businesses, but they're not looking after people. What can I do? So I thought I'd give it a little bit of thought about what the sort of things you can actually do to contribute towards improving the system. So the way I've broken it down, there are essentially only three things. There are kind of three ways that you could tackle this. The first is kind of a long-term thing, which I think we should all be doing, which is it's looking at the forces that might regulate our industry. So there are lots of sort of people who want to try and improve things and make it safer, and do something to try and make that a more solid offering. Because at the moment, things like the JCCP, it's a voluntary organization. It's very early days. Whether it's going to work or not is unknown. But maybe getting involved with something like that, 5, 7 years time, you might actually have been part of something that actually does make the industry safer for those people who are uninformed. So that's one particular option. It's a long-term game. Nothing's going to change very quickly, but that's one option. The next thing, which is quite a common one, is you could go out and troll the people who are bad practitioners, and you can leave comments on their Instagram, and you can kind of tell them that they're rubbish and that they're not safe and they're not injecting in the right place and they're not aspirating and they're not wearing gloves and they're not, you shouldn't be treating drunk people. All of those things are real things that I've seen happen, which, so one of your options is to go and do that. I think it might make you feel better in the short term. Weirdly, it's actually kind of helps them in the short term as well, because engagement on these posts drives organic reach. So the more comments there are on practitioners who you disagree with, the better it is for them, and more people get to see them and they become famous. And as you know, you all know of non-medic injectors who are actually quite famous, and often are very bad as well. But they're famous. It doesn't matter. There are enough people who know about them that they fill their clinics with people who want to be part of the fame. So we need to think about whether it's a good thing to report, to troll people on their Facebook groups, on their Facebook pages and their Instagram pages. But that is an option. And some people, you get a quick release of feeling like at least you've said something. But I don't think it'll do much. The next thing is you can report when you're involved with a case and there's a complication. I do actually really encourage this, because there's a big movement to collect data on exactly what the risks are in our industry to try and make it better. So the JCCP in particular are trying to pull data from the MRHA and from other bodies, the NHS England and all sorts of bodies are trying to get this data. I think SafeFace, by the way, Discovered are also collecting data. Now, hopefully this data all going into one place will become a force for regulation. Also, it's long-term, so you're not going to report someone who's caused a complication and immediately have their clinic closed down if it's the kind of thing that could happen in a well-run clinic too, like as an element of bad luck. It might be different if they're actually breaking really severe rules in terms of health, public health, but those are probably a bit rarer. So you can report people. And the final one is actually the one that I actually think we've got the most control over, and that's always a good thing when you have control over something. You'll feel a lot better, and that is to try and put stuff out there to try and explain to your audience what they really should expect from a good treatment. And I love this one because it's going to force everyone to get better. If you really start to think about what patients need to be safe, and you start to realize that the way for you to win and build your practice is to create a safer environment and a better offering for patients, and then you communicate that to everyone, you're going to do better. Your business will do better. And for this to work, you've got to believe in the best of people. And what I mean by that is, given the truth about the risk between a well-trained healthcare professional and a badly trained non-healthcare professional in terms of attitudes, given the truth between the spectrum of people who might be doing the procedures that we do, people are going to tend to make a good decision for themselves if they have all the facts at their disposal. Now, one of the problems which I realized recently is, if you're good at marketing on Instagram and you have no ability to review someone, you're basically pumping out a propaganda feed which you can edit. So anyone who comes on and says, "You really messed up my lips," you can delete that comment, you can ban them from your page, and you get on with your propaganda stream. And actually, there's no way for someone who's marketing on Instagram to be held to account. You can build a thriving business and have a really good looking, kind of looks like a well-established, great, first-rate clinic on the Instagram feed, and then the reality is something totally different. So that's a big problem for us. But what you can do is you can make your choice a better choice. So in your own marketing, put out stuff other than just before and afters. We all know before and afters work, but actually put out something about your ethos, what you promise to do for people when they're in a bad situation. If anything happens, how can you help them? What do you do to reduce risk? What do you do when things do go wrong? What kind of things can go wrong? And what are you doing every day to reduce the risk of it? Now, I know this is sometimes scary because sometimes we feel if we're completely transparent that people will think this is happening all the time and you'll put people off having treatment. But I don't think that's the case. I think people are clever enough to understand that if you do that if there are risks, that some practitioners are focused on that, they want to reduce that risk and they want to be prepared to solve the risk. And the more you talk about that, the more it's going to become one of the factors that people choose in terms of which practitioner they see. So the thing I'm calling for, apart from all the other things you can do, is to really get stuck in with selling the real benefits of being a healthcare practitioner. And what I love about this is it is going to make you have to think harder about what that is. That's going to make you a better practitioner yourself. You're going to communicate it more often. You're going to feel safer in your practice. You're actually going to get safer, and the choice will become obvious. Now, I don't know. We don't have power over what legislation is going to happen and how quickly it will have, but you do have power to change the mindset of the people who are looking for treatment really quickly by just pumping out really good quality guidance on how to get a treatment that'll make you happy and that will also keep you safe, and the practitioner, the whole package that comes with the offering that you have, rather than just focusing on the before and after, which, as you know, they're selective. You know, we can all take a before and after and leave that as that. It's a bit two-dimensional. We all know there's a before, there's a during, there's an after in terms of the person themselves, the risks, what can happen. So I think we need to, as a collective, really start to communicate much more about the benefits, because I know practitioners, we see these unsafe practitioners injecting and they're casual, and the rest of us who worry think, I can't believe that they're doing that. When I inject, I'm really worrying. I'm aspirating. I know my blood runs cold half the time because I'm concentrating so hard not to make a mistake. And then you see people doing the opposite. And I also know that so many of you will be up at 11 o'clock at night responding to messages. Often you'll go out and see patients late at night. I've heard of emergency reversals going on at midnight because you're putting in the extra effort to keep people safe. And actually, I don't think many people know that. I just don't think that people are fully aware of how much effort and time will go into making sure that your patients are safe. And I think we should all tell people more. You should all tell people more about what you're prepared to do to keep them safe, your commitment to safety, the way that having a governing body actually makes you have to do that. And how many times a day do we all think, about your registration, I've got to do this because my registration is important to me. I know that's a massive factor for so many healthcare professionals, and it just isn't if you're not on a registered body. So we should talk about that more often, and actually drive people to make a rational choice. So at the bottom of this request is believe that people are rational, and if they know the truth, they will make a good decision. I believe that of most people. Some people you can't argue with, but they're a minority. Most people want to keep themselves safe. They just don't know the choice that they're making. So that's kind of my thought for the day, given that little mini viral thing that's gone around with the lady who was treated awfully by that practice. But let me know what you think. If you think that's a good idea, let me know. Tag anyone who might be interested, who might agree with this. Share this post if you think more people should see it. And once again, keep the questions coming in. I have got a few questions to get through over the last few days. I have got a little bit behind. I've been really busy, but that's no excuse. I'll be back. I'll do another Facebook Live tomorrow. I hope that's interesting. And thanks everyone for watching.